Assalamualaikum warahmatullahi wabarakatuh. Our topic for today is sport for disabled population for dwarfism. So first, I will introduce my groupmate. Firstly, myself, Adib Traiman bin Abdul Rashid. Next is Nodamia binti Muhammad Fadil, Fatin Yuswana binti Rozman, Akmal Harid bin Roslan, Muhammad Fakur Syami bin Zainul Anan, and lastly, Nur Hanis binti Ahmad. First, we will talk about the definition of dwarfism. So dwarfism is, you can categorize them by it is having a short limb or short torso. The most easy way to say is dwarfism is when their organ that is smaller than the usual. For example, their arm, their leg. Next, the most common form of dwarfism is having the genetic disorder achondroplasia. For your information, even though they are shorter than us, their intelligence is normal as usual, and you need to most of them are having nearly normal life expectancy, just like normal human. Next, Dwarf Athletic Association encourage them to participate in sport regardless of their level of skill. They want to encourage them to compete in sport in competition such as track and field, basketball, archery, table tennis, and many more. So next we will go to the next slide.
Hi, my name is Muhammad Fakur Syami bin Zainul Anan, and I'm going to be presenting about the causes and types of dwarfisms and less stress. So what causes dwarfisms? It is a genetic disorder, usually from inheritance in a random genetic mutation in either the father's sperms or the mother's eggs. So, the most common type, accounting for 70% of all cases in short stature, is called achondroplasia. So, of course, dwarfism has other causes, but these five are the major causes. So, the first one is metabolic and hormonal disorders in infancy or childhood. It is a condition of growth retardation resulting in abnormally short adult stature and caused by a variety of heredity and metabolic disorder. Next is the chromosomal abnormalities. There are two major chromosome mutations. The first one is insertion and the second one is translocation. A chromosome abnormality, aberration or mutation is a missing, extra or irregular portion of chromosomal DNA. It can be a typical number of chromosome or structural abnormalities in one or more chromosomes. So the next one is the pituitary gland disorders. So the pituitary gland disorders are usually caused by non-cancerous tumor in the pituitary gland referred as the adenomas. It is a condition of growth retardation characterized by patients who are very short and have a normal body proportion. It is caused by a dysfunction of pituitary gland. The next one is absorption problem. This is one of the major factors because their body can make full use of the nutrients intake in their food. This causes an abnormality in their growth and keep them short and small. And the last one is kidney disease. Next, we go to the types of dwarfisms. There are two types of dwarfisms. The first one is disproportionate dwarfisms, and the second one is a proportionate dwarfisms. Now, for the disproportionate dwarfisms, Most people with dwarfism have disorders that causes disproportionately short stature. Almost all people with disproportionate dwarfism have a normal intellectual capabilities. These are the types of disproportionate dwarfism. They have an average size trunk, a short arms and legs with a particularly short upper arms and upper legs. They have short fingers and often with a wide separation between the middle and the ring fingers. They have limited mobility in their elbow and a disproportionately large head with a prominent forehead and a flattened bridge of the nose. They have progressive development of bow legs and progressive development of straight lower back with adult height around 4 feet, which is 1.22 meters. Next is the proportionate dwarfism. Proportionate dwarfisms result in medical conditions present at birth or appearing in early childhood that limit overall growth and development. Growth hormone deficiency is relatively common cause of proportionate dwarfisms. Next is the types of people who has a proportionate dwarfisms. The first one is their height is below the 3rd percentile on the standard pediatric charts. Next, their growth is rate slower than expected for their age. And lastly, they delayed or non-sexual development during their teen years. And that's it from me. Thank you.
Hi, my name is Fatinur Suhana binti Rosman. So my part is about treatment and prevention. So the first point is insertion of a shunt. A shunt is a hollow tube surgically placed in the brain to help drain excess fluid and redirect it into another location in body where it can reabsorb. For dwarfism, it because usually they have a larger head and it's help to relieve pressure on the brain. The second point is do a surgery to widen the spinal canal. The main point for this surgery is to relieve spinal cord compression. Third point is do a physical therapy. Physical therapy can help the dwarfism strengthen muscle and increase joint range of motion. The next point is nutritional guidance and exercise to help the dwarfism prevent obesity, which can aggravate skeletal problems. Surgery to remove tonsil and adenoid is also one of the treatment. It is to improve breathing problems related to large tonsils, small facial structure, or a small chest. Moreover, a tracheotomy surgery. This surgery is to improve breathing through small airways. The next point is extended limb lengthening. It is a controversial surgery due in part to its risk. It involves several procedures and that is why only adults can do this surgery. Last but not least, orthodontic treatment. It is for teeth to help relieve crowding of teeth caused by a small jaw. There is no definite treatment of dwarfism, but the treatment depends on the underlying cause of dwarfism. The next slide is about dwarfism prevention. Dwarfism cannot be prevented as such because it is mostly genetic. So, the first point is tested for any syndrome might have. People who are planning to conceive should get themselves tested. Next, growth hormone-related dwarfism can be prevented with the help of various therapies. Lastly, genetic testing of the baby immediately after birth can also give some time to the doctor to try out therapies to increase their height.
Hi, Assalamualaikum. My name is Nur Damia binti Muhammad Fadil and this is my part, which is I will explain to you guys about the safety, health and also the medical consideration of dwarf. Okay, so as I told you guys that I will explain to you about the elaboration about my points. So this is the slide. Okay, so I will continue with my first point, which is the car seats. I would recommend to all the parents out there who has a dwarf child to use a car seats with an infant car seats with a firm back and also a neck support, because these two things really make your child safe. As you guys can see at my picture here, I already give an example of a dwarf which is driving a car using a car seats. Okay, so for my next point is infant carriers and also play equipments. I think all the parents with a dwarf child need to avoid their child by playing infant devices such as swings, umbrella strollers, carrying slings, and also backpack carriers, because I think that all of these things doesn't give any support at the neck, and also it may cause a curve back into a C shape. Alright, so for my third point, that is educate neck and head support, which is you guys can use a padding. It does provide the right position and to support our child neck and also our head. Alright, so for my next point is complications. Complications, I may relate it with constantly check up with the doctor, because this is the same thing which we have to monitor our children for signs of complication such as ear problems and sleep apnea. Alright, so as I said, the dwarf itself needs something to support them to have a good posture. So this is a thing that promote a good posture, which is providing a pillow at the back at the lower back when you are sitting, and also a footstool. So for my last point is healthy diet. I think everyone, not just only dwarf people, everyone needs to have a healthy diet, because this is to avoid later problems with weight or also their body itself.
Assalamualaikum to Sir Hisham and my fellow friends. My name is Akmal Haribi Roslan, and now I will be presenting about the physical activity and sport consideration for dwarfism and les autres. First, we need to avoid activities that involving height, such as jumping on trampoline or hanging on monkey bar. This is to avoid them from falling. Why? Because of their spine susceptibility. The impact from falling may cause a strain on their spine in their neck area. Second, provide adaptable equipments. Because of their size, we need to provide equipment that equally to their size, such as smaller bats, small shortened field hockey sticks, and smaller ball for their legs and hands. For example, we can use tennis ball instead of softball while playing baseball because of their tiny fingers. Other than that, we need to provide shorter distance for their running activities. Because of their limbs are short, they need to take 3 or 4 steps for every 1 step that another people take to walk and run. They may not able to keep up with other people while running out on the field. So they should be allowed to take extra time if necessary. As same as the other group, we need to keep reminding them to have proper hydration to avoid dehydration and excessive loss of water from their body while they're doing sport. Furthermore, all activity that cause stress on their joint should be modified. For an achondroplastic dwarf's arm, they do not fully extend. Any effort to pull the arms straight up can easily cause the elbow or the shoulder to dislocate. For this specific type of dwarf, pull-ups or hanging on monkey bar should be avoided. Modify or find an alternate exercise for the dwarf can physically manage. Intensity and duration also should be considered based on the ability of the person. If they can do more, we may proceed. But if they cannot, we need to stop or decrease the intensity or the duration of the exercises. Finally, remove all heavy and big equipments that may give harm to them. Because of their limbs are short and their head is heavy, they may fall frequently while running and walking. This is normal, but we do not want if they fall onto the equipment and then the equipment fall onto them. This is the worst case can happen to them. All of this consideration is to ensure the safety of the dwarf and less ultras while they're doing sports and physical activity. Thank you.
Assalamualaikum, my name is Nurhanis. So I will discuss about the method of teaching for dwarfism and less ultras group. As we all know, different disabilities need different coaching methods. This is to ensure that they can perform tasks that are appropriate for their skill. So the thing that should be considered in coaching this group is start with the use of the clear instruction. This is because to make sure they really understand what they will do. Don't assume they know what I will mean without explaining clearly to them. Second, indicates what they can and cannot do. Always communicate with them about their condition and what the activities they can and cannot do. From this way, it will more easier to conduct them because we already know their limitation in doing something. After that, provide a short amount and times training. As we know, people with this disability will have limitation in doing something. They might get tired easily at the beginning, so just give them short amount of training and time suitable with their training program to avoid them getting injury. Besides, give them extra time getting to training place due to mobility issues. Let them take the lead and set the pace regarding walking or talking. Next, use plenty of demonstration and practice. Demonstration is the process of teaching someone how to make or do something in a step-by-step process. As you show how, you tell what you are doing. When providing demonstration, coaches should take time to allow the athlete to first visualize each part independently, then comprehensively at full speed of practice. Lastly, the coaches should focus more on increased range of motion and balance of the athlete. People with these disabilities can increase their range of motion by doing more on stretching every time go for an early training session. This also will help to improve their balance well.